Well, in about 45 minutes, the president will welcome doctors from across the United States to the White House and make remarks on the health care overhaul. He is expected to speak for about 15 minutes. We invited our own doctor to join us. Republican Louisiana Congressman Bill Cassidy is a practicing physician, and he joins us now live from Baton Rouge. Thank you for being with us.
Thank you, Patty.
Well, first of all, this meeting that President Obama is having with these other doctors, there really is no consensus among all doctors, is there, on this?
There's not a consensus. One thing the physicians want is a fixing of the Medicare payment formula. By the way, the Baucus bill, and that's going to cost about $235 billion. The way the Baucus bill has come in under $1 trillion is that it does not include this fix. So I'm wondering if these physicians will speak to the president about the absence of something which matters a great deal to those physicians that see Medicare.
So it sounds as though you're saying that you're not a huge fan of the Senator Baucus bill in the Finance Committee now.
I think I think it is less fiscal responsibility and more fiscal sleight of hand. It still spends a lot of money, inevitably will tax a lot and not lower cost. It's government-centered, not patient-centered. It's not the direction we should go in.
Well, what is the direction we should go in?
If you look at what works, is that by giving patients the power and an awareness of cost, they save money and they're healthier. So the direction we should go in is a patient-centered approach as opposed to the Baucus plan or the House Reform Bill, which is expanding government and raising taxes.
All right. Well, in a paper that you wrote, you cite systemic barriers to value-conscious decision-making, like the ban on transparency in pricing and other market distortions that undermine economically rational behavior. Explain.
When you go in for knee surgery, or someone else does, they don't know the price until they come out the door. Now, if you were able to know when you went in that this operation over here would cost you $1,000 and over here would cost you $1,500, and the quality were the same in both places, you'd go to the place that cost you $1,000. You cannot know that now in the current healthcare system, in part because of government regulation. And so those are some of the things that stand in the way of a patient-empowered system, a patient-controlled system.
You also cite excessive administrative overhead, which you say statistics show consumes 40% of the average doctor's costs?
A primary care physician, 40% of our overhead is related to billing. That's 40%. So if you lower, say, for example, we expand Medicaid as the Baucus proposal attempts to do by expanding government, and Medicaid is paying the physician 40% or 60% of her cost, she has to see that many more patients and order that many more tests in order to make things work because she has this fixed overhead related to billing. You can do things such as health savings accounts and other things which are patient-empowered that allow the patient and the physician to directly contract, if you will. That lowers her cost. She saves money, the patient saves money.
You're a member of Congress. You're also a doctor, as we said. Do you feel that Congress is listening enough to the medical profession?
You know, my concern is no, but I also don't think that they're listening well enough to the American people. In August, the American people very clearly spoke that they don't want a huge expansion of government with everything that that means, more taxes, less liberty, etc. And yet you see that the October recess is canceled for the Senate, supposedly so they can't go home and get an earful from the American people. The American people want a patient-empowered system, not an expansion of government. What they're getting is an expansion of government.
Well, as someone who's in the inner workings right now, what do you see actually happening here?
I think it's very much in play. I think that they're trying to use the Baucus bill as, oh my gosh, it's a statement that we really have controlled cost, when in reality, as Steny Hoyer says, who is the leader of the House Democrats, it's more keeping things offline than actually controlling cost. Are we going to go with a bill which doesn't control costs, expands government, or are we going to go with a bill which is patient empowering, such as the American people spoke of in August? I think it's very much in play. The American people need to have their voice heard. Well,
is there a bill or a bill even being discussed at this point that you would be satisfied with?
You know, H.R. 3400 is a bill which truly empowers patients. It takes things such as health savings accounts, which have been shown to lower costs by 30% and expand access to the previously uninsured. It also allows things such as the Safeway model, or the, if you will, the whole food models, where employees are financially incentivized to participate in healthier lifestyles, which ends up controlling cost. All these things which work in a patient-empowered model are in H.R. 3400, things that have been proven to work, not building on things like the other bills which have been proven not to work.
All right, Congressman Bill Cassidy, thank you so much for joining us.
Thank you, Patty.
About 18 minutes past the hour now. You know, the long-awaited H1N1 flu vaccine finally available this week.